It's almost dark at 5 o'clock, so you better start now. Okay, can I share? Shall I share now?
Sure,
Yes
Doc.
po.
Okay, share. Okay. Can you see?
Yes po, Doc.
Okay. But so our topic for today is a very important subject, and it it is given in a lot of questions are given in the recent board exams on nutrition. No, nutrition that would include the vitamins and minerals. So so that would be our topic for today: the fundamentals of nutrition. Okay. So these are our objectives: define terms used in nutrition, discuss important concepts on nutritional requirements, assess a person's nutritional state using standard criteria, calculate energy requirement of an individual, calculate ER in children, differentiate marasmus, kwashiorkor, and protein calorie malnutrition, discuss current issues in nutrition. Before we proceed, may I know if there is one in among you who is a nutritionist? Whose pre-med is nutrition? Meron ba? Because we want to learn from you. I'm not a nutritionist, na? I'm a pediatrician. I'm a pediatrician. So, uh, I'm not really the expert on nutrition, but I can teach it. Okay? Nobody? Is there no one here who is a nutritionist? Mahihain lang. But it's okay. So definitions, this is an important definition. What is nutrition? It's the science of food, nutrients, and other substances therein, their action, interaction, and balance in relation to health and disease, and the processes by which the organism ingests, digests, absorbs, transports, and utilizes and secretes food substances. So it starts from ingestion. No? So it would mean the preparation of, the food that will be given to the patient or to an individual. So it will depend on the state of the individual, whether he is normal or he is in a state of disease. So you have to alter the consistency of the food that you are giving. What are nutrients? The constituents in food, example, your fats, carbohydrates, proteins, vitamins, and minerals that are essential to the maintenance of health. Alam niyo na yun, no? RDA, the recommended daily allowance to the level of dietary intake sufficiently high to meet the requirement of almost all individuals, generated at 2 standard deviation above the mean. Well, a while ago, or several years ago, this has been changed to RENI, RENI, and this will represent the best estimate of the amount of nutrient that is adequate for the individual. No? So it means that the the computation for the calories, what is needed for nutrition, is depends on the nutrient that is adequate for the individual. Okay, we will be using RDA for our discussion, because that is what is the most that is that is the most used term. So, what do you mean by computed at uh, two standard deviation, except for the energy? Now, the energy should be computed and given to the patient or to the individual at the mean. Okay, it should not be uh, +2 standard deviation or -2 standard deviation. The energy should be at the mean. Okay, but can be uh, most nutrients can be uh, computed at +2 standard deviation or -2 standard deviation would still be all right, no? Okay. So recommended daily allowance, the level of nutrient intake sufficient to meet the needs of almost all healthy individuals of a life stage and gender group. Okay, the rest please read. They are not used frequently, but the minimum daily requirement is the smallest exogenous supply of a nutrient that must be absorbed or consumed to prevent manifestations of deficiency. Okay? So, for example, what is the least amount of carbohydrate that you can give to an individual without him going into excuse me, ketoacidosis, 50 to 100 calories of carbohydrate. What is nutritional status refers to the condition of the body as a result of the ingestion of and utilization of food. And malnutrition is a pathologic state resulting from a relative lack or absolute deficiency or excess, no, of one or more of the essential nutrients. It can be primary, or secondary. How is it primary? How is it malnutrition uh, can be had primarily? I mean, in the primary state. Huh? Anyone? Anyone can tell me?
Lack of intake po.
Yes, lack of intake or lack of supply. No, that can be it. Lack of supply or lack of intake. What about secondary?
As a result of a disease condition, po, Doc.
Yes. Okay. So that can also be, or lack of intake can also be included in the secondary, di ba? Kasi even if there is food supply, if the individual has no appetite, then that will already be uh, lack of intake. Okay, nutrient density is the amount of micronutrients in relation to the amount of macronutrients. So kilocalorie is the energy or the amount of heat energy required to raise 1 kilogram of water 1 degree centigrade. What are the energy yielding nutrients? Nutrients that break down to yield energy in the body. Carbohydrates, proteins, and lipids. So your vitamins do not yield energy. No? Your minerals, they do not yield energy. But they help in the metabolic processes. Okay? Now, factors that determine RDA: age, body size, sex, workload, physiologic condition. Nutrient are chemical substances derived from food. So remember, derived from food, no? And they are used for energy, structural material, reduce risks of some diseases. So what are food? What are foods? They are the products derived from plants and animals. So yung mga synthetic dyan, they are not considered as food, no? Yung mga gusto nyong kainin, yung mga chips, they are not considered as food. That can be absorbed by the body and yield energy. although this synthetic like chips food material can also yield energy, Like, concepts of energy requirement. Yeah. Oh. So 1 kilocalorie. So ito yung ano niya, kcal. The amount of heat required to raise the temperature of 1 kilogram of water, 1 degree centigrade. That is by direct calorimetry. Okay? We have the indirect calorimetry, which is your respiratory quotient. Now, the international unit for kilocalorie is your kilojoule. Okay? So if you read manuals or if you read journals, uh, most of the time you will be reading the use of kilojoule instead of calorie. Okay, but here we still use calorie. So 1 kilocalorie is equivalent to 4.184 kilojoule. And this is the indirect method. The RQ or respiratory quotient is used to indirectly determine the heat evolved or the caloric content from the oxidation of food or caloric requirements of individuals in contrast to direct calorimetry. It is the ratio of carbon dioxide to oxygen in the oxidation of food. Okay, so let's see the energy given off by the different macromolecules. So, nandiyan yung alcohol, no? Sadya ko yan para alam nyo. So, carbohydrates has an RQ of 1, and per gram of carbohydrate would give you 4 kilocalories. Okay, or in kilojoule, it's 17 kilojoules per gram. For fats, RQ of 0.7. Now, your kilocalorie per gram is 9. Mabigat siya. Masyadong malaki yung caloric content niya. And kilojoule is 37 per gram. Protein is the same as carbohydrates. Okay, so 17 din yan. Now, alcohol. What do you think? 7. So it contains uh, 7 calories per gram of alcohol. Okay? So so that you should not be surprised why these beer drinkers, develop big tummies, no? Fat, uh, fat abdomen because of this. It would be the same, more or less the same. Saan ko ba ito ilalagay? Okay. Again, the same. Happen. So calculation of energy requirement. This is very important because you will be doing this all the time, no? It's considered as the most basic nutritional requirement, taking precedence over all other nutritional needs. And these are the components of of uh, your calculation for energy requirement. In the basal metabolic rate or the basal metabolism, the basal metabolic rate or basal metabolism is the resting energy expenditure. And the physical activity will depend on the physical activity of a person, metabolic response of food or the thermic effects of food or a specific dynamic action of food. Okay? So, now how do you get the BMR? So, by indirect calorimetry, calculation is 24 kilocalorie per kilogram per day. Okay? 24 kilocalorie per kilogram per day. Given yan. Given yung 24. And yung, ano ba yung REE? Resting energy expenditure. Okay. These are measured soon after waking, 12 hours after a meal, and awake, individual is awake and in a reclining position. Okay. This is given by the WHO, calculation for adult male, o hindi na kailangan yan kasi you will be computing by the weight of the patient, no? When you are already given the 24 kilocalorie per day. So, but then it's good to know. It's good to know about this, okay? So just know about it. And it increases with routine activity for patients with multiple fractures, patients with sepsis, so 90%, 90 to 100% of patients with burn injury. And BMR increases with fever, hyperthyroidism, cold climate, increased muscle mass, and it's higher in males and children. Okay, so BMR, this is the computation weight of the patient, weight of the individual times using the kilocalorie, 24 kilocalorie per day. So, ito na tayo sa calculation. By factorial method, because we use all the factors, we include all the factors in the process, no? So first calculate the BMR using the standard formula of 24 kilocalorie per day. Okay, or you may deduct 10% for every hour of sleep. Kung palatulog ka, bababa ang BMR mo. Then calculate for physical activity. I will give you the different degrees of physical activity. Light, that's 30% of the BMR. That's how you calculate for PA or physical activity. Moderate is 40% of BMR. Heavy is 50% of BMR. Then calculate for the specific dynamic action of food, which is 10% of the sum of the BMR, and the physical activity. Then calculate for TCR, BMR plus physical activity plus SDA. Okay, did you get that? Okay, everybody should know about this. This is very important. A description of activity levels. Light. Who are the individuals that are considered to have light activity? Office workers, most professional men and women, unemployed men, housewives in houses with mechanical appliances, students, teachers. So kung kaso nyo, teacher or student, you should compute it to 0.30%. No, 30% pala. Moderate, most men in light industry, farm workers, fishermen, housewives without mechanical household appliances. So yung naglalaba without the washing machine, yung nagbubunot, what bunot is, yung nagpaglinis ng bahay. And for heavy, some agricultural workers, forestry workers, army soldiers in active service, dancers. Ito yung profession, no? Hindi lang yung nagsasayaw ka in a disco once a week. No, that's not the one. But you can add the amount. You can add the calories if you are dancing in that particular day, okay? The athletes, and this also refers to the professional athletes, lumberjacks. Okay, this is an example. So a male adult farmer with a height of 160 centimeters. Okay, what is the ideal body weight? So you get the weight, the height in centimeters minus 100, okay? And times 0.9 is 54 kilograms. BMR, so 24 times 54. You use the ideal body weight for the BMR, okay? Equals 1,296 kilocalorie. And the physical activity, uh, how do you consider a farmer? Moderate, right? So times point time 40% equals 518 kilocalorie. Then for SDA, or the specific dynamic action of food, so 10% of the sum of the BMR plus the PA. Okay, so equals 181.4. And the TCR should be the BMR, which is 1,296 plus PA 518 plus SDA 181.4 equals 1,995.4 calories, kilocalories per day. Okay? Is there any questions so far? Any questions so far?
None po.
Okay, good. Now, if you are busy now, like for example, if you already have your own clinic and you have a lot of patients, you want to do it faster, to use the cross method, and this is the most practical and rapid. But you do not use this in our class, no? I want you to do the factorial method in our class based on desirable body weight and the type of work or occupation. So just get the desirable body weight and multiply it by the occupation used in clinics and hospitals. Kung nagmamadali ka na, no? But you are still students. But you have to know this type of method. So determine, these are the steps. Determine the desirable body weight and multiply by the activity factor based on the desirable body weight. So again, there is a different classification of patients in the Krauss method. So bed patient and those who are at bed rest is given 12 kilocalorie per 25 kilocalorie, 25 calories per kilogram. And light work, 30 kilocalories per kilogram. Moderate work, 35 kilocalorie per kilogram. And heavy work, 40 kilocalories. Okay? So here, example, GM, 50-year-old female, weighing 50 kilograms. That's already the desirable body weight. The teacher. So 50 times 30, no, 30 siya. Let's go back. Light work, 30 equals 1,500 kilocalories per day. Now, additional expenditure for a 70 kilogram man for different activities, you can add for that particular day lang, or for that particular moment that you are having this activity. For example, you're cycling. You can add 175 kilocalorie per hour. to your per hour of biking, no, to your caloric requirement for that particular day. Dishwashing, 70. So don't be lazy, Kailangan na magtulong kayo sa bahay. Wash your dishes because it will also that will give you can add, no? You can add 70 per hour of dishwashing. Driving a car, 63. Eating, 28. Lying, still awake, 7. Running, 490. Swimming, that's the best, 553. And walking, 3 miles per hour, equivalent to, multiply, gusto mo ng kilocalorie, 1 mile is 1.6 kilometers. O kilometers pala. Is 140. Additional concepts. Adding 1 mile of walking each day, so that would be 1.6 kilometers each day for 1 year. That will be equivalent to caloric equivalent of 10 pounds. No, you will lose 10 pounds. You will lose 10 pounds if you walk 1 mile or 1.6 kilometers per day. And to lose or gain weight, you have to add 7,500 kilocalorie per kilogram of the weight that you want to lose. No? For example, you want to lose 4 kilograms, so that would be 7,500 times 4. O ilan yun? Okay? But you cannot do this in one day. You have to do this in several days. Like for example, if you want to do this in 2 weeks' time, then you can calculate by multiplying how many days there are in 2 weeks. Ilang araw ba yun? How many days are there in 2 weeks? 14 days, right? 14 days. Then the sum of this 7,500 times 4, okay, divided by, ilang ba yun? Ilang days? 7 weeks. But that would be so, that masyado yung malaki, no? That would be too big. So anyway, now after you have computed for the TCR, after you have added the BMR plus PA plus SDA, then that would be your TCR for your daily TCR. So you distribute it into the macromolecules, okay? For carbohydrates, you give 55 to 70%. This is the range, no? Depending on what the patient needs. If the patient is obese, then make it the lowest range. If the patient is wants to gain weight, then give the higher amount of carbohydrates. But the average that you can give is 58%. 58% of the total caloric requirement. And for fats, you give 20 to 40%. 20 to 40% of the TCR, and the average is 30. Again, this depends on the condition of the patient. If your patient has dyslipidemia, then you have to give the least amount of fats. No? But if your patient is lean, is cachectic, or has cancer and wants to gain weight, so you can give the higher amount. But these are the kinds of fat that you can give. 10% saturated, 10% monounsaturated, and 10% fully unsaturated fats. Protein is 10 to 15%. 10 to 15% lang per day ang kailangan mo sa protein. And the average is 12%. Okay? Cholesterol, you can give 300 milligrams per day if you are normal. I mean, if the individual is normal. And salt is 3 grams per day. 3 grams per day. The patient is hypertensive, you can decrease the amount of salt. Can decrease the amount of salt. And of course, the cholesterol. Any questions? Human nutritional requirement. So amino acids, fatty acids, vitamins, minerals, fiber, energy. So carbohydrates, energy. Then do not forget your water. Not forget your water. So what is a proper diet for an adult? Is the one that maintains health and a constant body weight. So hindi maganda yung it's not healthy if you gain weight for one in a month and then lose it again and gain weight again. So that is not healthy. Of course, you know what are the macronutrients: carbohydrates, protein, and lipids. And essential nutrients, I know you know this, that cannot be synthesized by the body. It's called indispensable. Non-essential can be synthesized by the body from precursors. Composition of body fuel stores: triglyceride, adipose tissue or adipose triacylglycerol is the major fuel store. 85% of the fuel is in triglyceride. Yung protein only has 15%. Glycogen or carbohydrate is 1%. Now, 1/3 of the body protein can be degraded for energy. But every day, there is degradation of protein normally, about 1 to 2% of the body protein is being degraded. But proteins cannot be stored in the body, unlike your carbohydrates and your fats. What is the storage form of carbohydrates? Carbohydrates. Storage form. Anyone?
Glycogen.
Yes, glycogen. For fats, triacylglycerol. Okay. And but proteins cannot be stored, no? They can only be pool in the body, but all this can be used in the synthesis of proteins, of other proteins in the body. Okay? So that is why you have to take in proteins every day. Now you can an individual can follow this pyramid for the different foodstuffs. This is the base, no? And it is the biggest part of the triangle, consisting of bread, cereal, rice, and pasta. This is called bread, cereal, rice, pasta. Group is you have to give 5 to 11 servings per day. 5 to 11 servings. And this is fruit group, 2 to 4 servings per day. Per day yan And the vegetable group, 3 to 5 servings per day. Sino bang nakakaano niyan? Who does it? And this group is the meat, poultry, fish, dry beans, eggs, and nuts. 2 to 3 servings per day lang. And these are the yogurt, cheese group, 2 to 3 servings then. And these are the food stuff that you can use only sparingly, like fats, oils, and sweets. Okay? So, hindi pwede isang bar ng chocolate to ubusin mo sa isang araw. Can be guided by that triangle. Okay. Now, in order to prevent ketosis, you have to give 50 to 100 grams of carbohydrates per day. No? So these are the functions of your carbohydrates. You know that very well, and also your fatty acids and your linoleic acids and linolenic acids are the essential fatty acids. Other nutritional considerations. So of course, if your food doesn't have fats, it doesn't taste good, right? It's not palatable. So you have to add fats. And a polyunsaturated saturated ratio of fatty acids is desirable for the plasma cholesterol lowering effect. And what is the glycemic index? Measures the average amount of blood glucose rise after eating a given amount of carbohydrates. And this is standardized glucose, which is 100. Okay? So this is very important, especially for diabetic patients. So you have to choose the kind of carbohydrates that you will give to your patient. Important for diabetics whose rise in blood sugar level should be controlled. Examples, your baked potato has 98, so it's very high. It has a very high glycemic index. Banana has 62, pwede na rin, no? Grapefruit has 26. So if you notice that most of these diet programs have grapefruit in their menus. Pasta has only 50, so which is better than baked potato. And here is the list of other carbohydrates and their glycemic index. You can refer to this when you prepare your food, when you prepare your for the forum, okay? And if you have diabetic patient, then you have to refer to this and give a carbohydrate, preparation of carbohydrate that has a low glycemic index. If you notice ito, nakakapag, I mean, it's surprising, no, that carrots has 101, is 101 in the index. So mas mataas pa siya kaysa glucose. And white rice is 126. Cornflakes, 119. So be careful with that. Protein, protein intake is 0.8 grams per day, per kilogram per day. And you know the essential, the essential amino acids. If wala pa kayong protein, no? Wala pa. So anyway, this is the acronym that I made for myself since first year college, first year proper. Yan. So they cannot be synthesized by the body. normal adults we have adequate intake of protein, and so we call ourselves nitrogen balance. In nitrogen balance, in other words, the synthesis of protein is equal to the protein degradation. While nit- those individuals with negative nitrogen balance, or in those who are sick, um, they have inadequate protein intake, and compared to the uh, excretion of protein. Excuse me. And positive nitrogen, if your intake is higher than your than excretion of nitrogen, and occurs during growth and convalescence. Now, this is the scoring for amino acid and limiting amino acids. So, the score is the amino acid score has a standard of 100, and that is human milk. No? Human milk has amino acid score of 100. Ibig sabihin, all the essential amino acids are present. No? All the essential amino acids are present in human milk. And so there is no limiting amino acids, meaning no amino acids is missing, is lacking, deficient in this milk, human milk. But cow's milk is has 95 score, no? Amino acid score of 95 because it lacks the sulfur containing amino acids. Sulfur containing amino acids like cysteine, uh, methionine, and egg also has an amino acid score of 100, so there is no limiting amino acid. Beef, fish, and so with fish, no? Fish, beef, eggs, they are all they have all of them have 100% amino acid score with no limitation, with no limiting amino acid. But rice has a score of 67. It lacks lysine. Peanut will be surprised because they said that this is food for the brain, right? But the score is 65, and it lacks lysine and threonine. Okay, and beans then, no? As a score of 54, it lacks the S-containing amino acids. So mung bean, you're fond of mung bean, right? During Fridays, especially during the Holy Weeks, and see the score is only 35, and it lacks the S-containing amino acids. This would be the same as the previous one. Fiber, I know you're familiar with fiber. Okay, cell, a component of the cell wall which are indigestible. Example, insoluble lignans, cellulose and soluble polysaccharides, and hemicellulose. Okay, this is important because what? It is uh, it it's good for the bowel, no? Good for the bowels, and it will decrease the incidence of cancer, colon cancer. Beneficial to diabetics as it decreases the amount of blood sugar and also the amount of cholesterol in the blood. Now, vegetables and fruits are good sources of vitamins and minerals. They also contain phytochemicals and sterols that provide health benefits. One of them is antioxidant. Assessment of nutritional status. Okay. So it is not just enough to compute for the TCR and distribute the macromolecules to uh, distribute the TCR to the different macromolecules. But you have to assess the nutritional status of the individual. Okay. So how do you assess the nutritional status? By dietary survey, food recall, food diary, food composition table, food exchange list, by anthropometric measurements. Okay. Anthropometric measurements. We have formulas for this. And medical history, of course, clinical examination, and biochemical tests. And this occurs earlier than the clinical manifestations in detecting specific nutrient deficiencies. Okay, you can detect, say, for example, iron deficiency by testing for serum iron or a protein. If a patient is edematous and to you think of protein deficiency, so you ask for serum protein. So let's go to anthropometric measurements. Now, initially, we have the Gomez classification for preschoolers, but this is not anymore used because there is a better one, which is the Waterloo classification. And okay, so this is calculated by weight for height and height for age. Okay, this is important because it detects wasting for acute malnutrition and stunting for chronic malnutrition. Okay, for formula for wasting: actual weight over the ideal weight of the patient, not the child. Ideal weight for actual height times 100. Okay, so actual weight of the patient over the ideal weight for actual height times 100. Formula for stunting: the actual height over the ideal height for age. So this is for chronic malnutrition. This is for what? For for not chronic malnutrition. And this is how you rate them. Mild is 80 to 90% of the standard. Moderate is 70 to 79% of the standard. Severe, 70%, less than 70% of the standard. So this is Waterloo's formula for stunting. Actual height times ideal height for age. Normal is 95%. Mild is 90 to 95% of the standard. Moderate is 80 to 90% of the standard. Where severe is 80% of the standard. For anthropometric measurements, okay, for adults, body mass index or the BMI. So you get the kilogram, you get the weight, and divide it by the height in meters squared. Okay, normal is 18.5 to this is by WHO, no? 18.5 to less than 25. Underweight is below 18.5. That already is chronic energy deficient. And overweight is 25 to 29.9. And obese is more than 30. So please Get that formula. Well, Asia Pacific is what we use for the Philippines. For Filipinos, underweight is the same, less than 18.5. And BMI yan, normal is 18.5 to 22.9. And overweight is 23 to 24.9. While obese is 25 and above. So we will be using the Asia Pacific criteria. Well, this is the calculation for DBW or IBW in children, a desirable body weight. It will depend on this is for the first 6 months. It will depend on on the birth weight in grams plus age in months times 600. Okay. Now, if the birth weight is unknown, use 3,000 grams. 7 to 12 months, the ideal desirable body weight in grams is birth weight in grams plus age in months times 500. From 12 to 24 months, desirable body weight in kilogram na to, whilst age in months times 2 plus 8. Now, for children more than 24 months, desirable body weight is number of years times 2 plus 8. Pareho siya. Okay? So you can refer to this if you are given a case of an infant or a child. I think you will be given one of this in your forum. So calculation of height in children at birth, 50 centimeters. 1 year plus 24 centimeters plus 215. At 2 years plus 12 centimeters. At 3 years plus 8 centimeters. From 4 to 8 years plus 6 centimeters every year. And the TR in children, TR per day, 1,000 times 100 times age in years. So 1,000 times 100 times age in years. And the range here is 1 to 3, 1 to 3, 1 to 3 years, kilocalorie per kilogram desirable body weight, 105. From 4 to 6, it's 90. From 79 to 75. And from 10 to 12, for boys, 65. And girls, it's 54.6. So you have to know this, and then you have to know the per kilogram, the kilogram body weight of the child. Any questions so far? You can just refer to this. Now, how do you distribute the TCR to the different macromolecules? Again, it will differ on the age group of the patient. Carbohydrate is proteins, fats, and carbohydrates. From 0 to 5 months, 5% for carbohydrate for proteins, and 40 to 60% from fats from the TCR, and 35 to 54% of the TCR for CH for carbohydrates. From 6 to 11 months, it's 8 to 15 for proteins, 8 to 15% of the TCR, ibig sabihin. 30 to 40% of the TCR for fats, 45 to 62% of the TCR for carbohydrates. While for children, age 1 to 2 years, for protein, 6 to 15, and for fats, 25 to 35% of the TCR. For carbohydrates, 50 to 69% of the TCR. And for children from 3 to 18 years, is 6 to 15% for proteins and 15 to 30% for fats. The TCR, 55 to 79% uh, for carbohydrates. Any questions so far? Now, nutritional disorders, protein energy malnutrition, decreased intake of energy and protein, increased nutritional losses, increased nutrient requirement because of underlying illnesses, fever, surgery, or cancer. So difference between marasmus and kwashiorkor. It's an early onset in marasmus and later onset in kwashiorkor after breastfeeding is stopped. No? And growth failure is more pronounced in marasmus, very pronounced in kwashiorkor. There is no edema for marasmus, there is edema present in kwashiorkor. The serum protein is normal, while a serum protein is markedly reduced in kwashiorkor. In marasmus, there are no skin changes, while in kwashiorkor, there is depigmentation and hyperpigmentation of skin. The liver is normal in marasmus. There is fatty liver in kwashiorkor. Loose folds of skin in marasmus, hair discoloration in kwashiorkor, wasting in marasmus, and wasting and stunting. Stunting siya sa kwashiorkor. Okay, so here are examples. This is kwashiorkor. Now, why do you think he doesn't look like a patient with malnutrition? Because of the edema, no? Or anasarca. Anasarca is edema of the whole body. So even the weight is not decreased, no? And this is an example of marasmic patient. So you see that the skin, subcutaneous skin tissues are reduced, markedly reduced, no? And he has pot belly abdomen, and a wizened facial expression. Facial, okay. So let's look at some issues, current issues in nutrition. Vegetarianism, a practice which has arisen as a result of religious belief, health, economic, ethnic, or ecological reasons. And this would include vegetables, fruits, cereals, bread, yeast, dry beans, peas, seeds, sugar, seaweed, and vine curd. Okay? Walang meat, no? Walang meat siya. But what are the nutrients that are low in the vegetarian diet? Iron, B complex, or vitamin B, B12, calcium, the essential amino acids lysine, methionine, threonine, tryptophan. Because there is no intake of protein, no? Kahit fish, wala. Zinc. So these are the nutrients that are low in a vegetarian diet. This megavitamin therapy, can you give vitamin supplements above the RDA? You can give from 10 to 1,000 times the RDA if the patient needs it, no? May alleviate symptoms in certain disorders. And antioxidant nutrients they block free radical effects. Free radical effects. So these are the beta carotene, vitamin C, vitamin E, and selenium. So 2022 nutritional survey, severe malnutrition among children, high percentage of wasting and stunting. This is for Filipinos, no? 1/3 of adolescents 10 to 19 years of age are stunted. Among children 5 years and below, stunting is 25%, wasting is 19%, undernourished is 32%. Okay, thank you. Any questions so far? Any questions? Any questions? So you can copy. How will you copy the, the the anthropometric measurements for children. Iba man, I did not include this in your PowerPoint. So how will you copy this? We still have to answer the questions that I have given you. Okay, this is a formative quiz. Did you answer them? So base your answers and computation on the following case. EQ. A construction worker weighs 70 kilograms and stands at 170 centimeters. What is your assessment of EQ's nutritional status? Ano ba siya? Undernourished, normal, overweight, obese? Just tell me what. Anyone? Anyone? Anybody? Did you not answer this in your in your canvas? Although this will not be graded because this formative, no, formative exam. So, and what would be your answer here? How will you solve for this? Solve first for the ideal body weight, which is 170 minus 100 minus 70 pala. 100 minus 70 equals 70. So 70 ang ano niya, ang ideal body weight, which is his actual weight. No? So the patient is normal. Now compute for TCR. What would be his activities? Yun na lang sagutin nyo. What would be his activities? Kasi yung formula naman is given. So you can look into that or you can do that uh, by yourselves, no? So compute for TCR. What did you use for your physical activity here? Since this is a construction worker, you should give the come again, heavy, right? Okay, so times, yes. So, okay. So you just compute, no? TCR. Okay? So 70 times 24 would be how much? That would be your BMR. Because ito ideal body weight na yan. That would be your BMR. And then PA is 50% of 50% of ilang bang answer dito? You solve for that? Yes, sir. Walang nag-solve. Oh, I will hold you responsible for that, no? Ibig sabihin, I will hold you responsible, meaning I will assume that you know how to compute for the BMI, okay? The BMI of your patient. And to compute for the TCR, making use of the BMR, making use of the SDA and the PA. So what would be your PA here? It's you said 50%, no, 0.50, right? Okay. So just tell me the percentage. How many calories were you assigned to carbohydrates? Anyone? This is a construction worker. And so you will have to give what? How many percent of the TCR will you give for carbohydrates? Walang nag-solve? Anybody?
55%.
How many? Ano? 65? Yes, oo, pwede na yung 65. For fats, how many percent will you give? How many percent will you give for fats? Now you have to give the
40%.
how many percent?
Pwede 20%.
20%. Pwede na rin, no? So during your exam, I will not require you to solve na lang. I will not require you to solve, but I will just ask you the percentage of the different macromolecules to be assigned to, the TCR assigned to the different macromolecules. Is that clear? Di na, kasi you will not be allowed to use calculators. Now, to proteins, how many?
15% po.
15. Ilang percent pa? So, this is the maximum amount. This is the maximum range of your protein, di ba? Why do you want to give the maximum amount of proteins?
Construction worker po.
Yes, okay. He needs the muscle mass. No? So he needs the mass. Needs more protein to build his muscle mass. So, tama ba? Ilang percent ba yung carbohydrates natin? 65 plus ilang percent yung fats? 20 plus 15? Is that 100%?
Opo.
Okay, good. So, that is how you should do it, no? Now, this one. Answer the questions based again on the case. AB, a 40-year-old male, is diagnosed to have lung cancer stage 4. He weighs 45 kilograms with a height of 170 centimeters. Physical examination findings include loss of subcutaneous tissue, muscle mass, generalized edema, and large liver and skin pigmentation. So what is the patient suffering from? Remember, there is loss of subcutaneous tissue. And you have generalized edema, enlarged liver, and skin pigmentation.
Kwashiorkor po, Doc.
Come again?
Kwashiorkor.
Yeah, but in kwashiorkor, you don't lose, there is no loss of subcutaneous tissues. So this would be protein calorie malnutrition. Okay? So the deficiency of both protein and energy. Okay? Now, which of the following food sources will best help restore AB's nitrogen balance? Mung beans, cow's milk, fish, tofu. Think of the fish that has score of 100 or higher, a higher score. The food stuff with the highest score in amino acid.
Fish po.
Doc.
Fish. Okay, fish. It has an amino acid score of 100. Okay? So, wag niyong maliitin yung yung mga isda dyan. Tilapia. Okay? Bangus. What is the least amount of carbohydrates that you can give daily in order to prevent ketosis? Andiyan na yan sa lecture, no? So, ilan?
50 po.
50 grams. Okay? Number 9, what will be your recommendation to AB's siblings in order to prevent occurrence of cancer? Lung cancer pala, I'm sorry. hindi colon, among them.
Intake of fruits and vegetables po.
Yes, increase intake of fruits and vegetables in your diet because there are antioxidants there, and usually cancer is due to what? Free radical accumulation. No? What is AB's BMI using Asia Pacific? Andiyan yung kanya height. Yes?
15.57 daw.
15, yes. So therefore, the patient is what?
Underweight.
Underweight. Yes, underweight. What is AB's ideal body weight?
63 daw.
63 ba? Ano ba yung height niya?
63 kilogram po. 170 centimeter.
170 centimeters.
170, yeah. Minus 100 is 70. 70. 70 kilograms. Right? Diba? Right?
Times 0.9 pa po, di ba, Dok?
Times 0.10. Times 0.10.
Times
Sige. Times 0.10. Number 12, in order to maintain good nutrition, one should take how many servings of vegetables? The vegetable group. Ilan ba yun? Naalala niyo ba? Vegetable?
3 to 5 po, Dok.
3 to 5 servings. 3 to 4 na nakalagay dito, no? Sige, 3 to 5. Okay, number 13. Which of the following protein sources lack the S-containing amino acids?
Cow's milk po, Dok.
Cow's milk.
Come again?
Cow's milk. Cow's milk.
Yeah, cow's milk and ano ba yung beans? Beans din, di ba? Dalawang, dalawang answer dyan. Okay? Number 14, ED. A 21-year-old female wants to lose 10 kilograms in 8 months' time. How many calories should you subtract from his daily caloric intake in order to attain his goal? Anong gagawin mo? Just tell me how you will do it. Per day, no? How many calories will you subtract from his daily caloric intake? He wants to lose 10 kilograms in 8 months. Tell me what you will do.
312 kilocalories po.
312. So what did you do?
10 kilogram times 7,500 kcal po.
Yes.
Tapos yung 8 months times 30 po. Bali 240 divide 75,000 divide 240 po.
Okay. Okay. Very good. Number 15, which statement about protein in the diet is correct? Is it the biologic value of protein is the ratio of the amount of protein retained over amount ingested, or the protein quality is the ratio of the essential to non-essential amino acid. Requirement of protein is 0.8 milligrams per day. Alin ba? Are all of this correct? Tama ba lahat? Yeah, but the best answer there is letter B. Dapat letter B ang best answer mo dyan. The ratio of the essential to the non-essential amino acids. Okay? So, any questions? Now, I will give you your assignments for the next meeting. Again, I wasn't able to post this. Yung mga cases. Ipopost ko na lang siguro sa ano. What about the ano, the additional lecture on the PowerPoint? How will you get it?
Okay lang po ba i-post? Like po.
Come again? Popost ko na lang ulit
Apo.
yung PowerPoint.
Apo, daw.
Ganun na lang, no? I will just post it again.
Thank you po, Doc.
Okay. And the assignments. Teka. Here. For our, ano, for nutrition 2. So, you will have it separately, you know? Section A, Tuesday morning, and section B, Tuesday afternoon, and Wednesday morning for section C. So I will give you the same cases, no? There are 10 cases here, and you have 10 groups, no? Each section is divided into 10 groups, right? Laboratory nyo. So group 1, please take group 1 for all sections, no? Section A, section B, and section C. Take number 1. Group 2, take number 2. Group 3, take number 3. Group 4, take number 4. Group 5, etc. And so on and so forth, no? Group 5, number 6. Group 6, take number 7. Take number 6. Group 7, take number 7. Group 8, take number 8. And 9, take number 9. And 10, take number 10. Is that clear? Is that clear? You will answer this in the form of presentation. Okay? So you have to do all the calculations and how you will modify the diet for each case, because these are cases, no? These are cases. The number 1 case is what is this? Anorexia nervosa. Case number 2 is constipation. Case number 3 is gout. Case number 4 is what is this? Liver cirrhosis. Case number 5 is coronary heart disease. Case number 6 is allergy. Case number 7 is ano ba ito? Renal failure. Case number 8 is dyslipidemia. Number 9 is hypertension. Number 9 is hypertension. Number 10 is diabetes mellitus. Okay? Did you get that? I will post this today. I will have this posted today and together with the PowerPoint. Together with the PowerPoint. Is that okay?
The question po, is
Yes.
that different po from the GIT forum or
No,
is it the
no. You will be given different cases for GIT forum.
okay po.
Now this is for our own discussion. Kasi we have nutrition 2 is the practical side of nutrition. So I have given you several guidelines in how to modify cases. Did you get that? It is in the canvas. Did you get that? It's in the canvas. For nutrition 2. I gave you cases, several cases, but these are just some modifications. You can read other books like internal medicine or but do not emphasize too much on therapeutics on medications, no? Just emphasize the nutritional therapeutic, nutritional therapy, how you will modify the diet of a patient with say diabetes mellitus and the reasons for the modifications. And of course, you have to compute for the TCR. You have to compute for the BMR and distribute the different stuffs or rather the TCR to the different macromolecules. Is that clear? Is that clear? So you will present that. All of you will present it during the session. Any questions? The difference between this and the forum is that in the forum, you will prepare actual food. You will prepare the food itself, no? So you will convert the grams, convert the calories into grams and then convert it into food, actual preparation that you will prepare for your group. You will prepare for your group and this is for the forum, no? For breakfast, lunch, and dinner. But this one is just presentation. So you just prepare it in PowerPoint form, no? And present it during the session. Any questions? So you do the computations and of course you have to tell us what is the disorder that your patient is suffering from, no? And at the end, you give us the modifications of the diet and the reasons for the modification. For example, your diabetes patient, so you lower the carbohydrates that you give it the lower form of glycemic index of carbohydrates, no? And of course, you can lower down the carbohydrate that you will give to this patient. Okay? I have given you some items, some modifications, and some therapeutic nutrition in your canvas for the second session of nutrition. For nutrition number 2. Any questions? This is for next week, Tuesdays and Wednesday. Okay, so I will post it now, this afternoon. And so you can read your cases. Okay. I have not given any case of a child here or an infant, but probably in the forum you will be given one. So any questions?
Doc, excuse lang po. Bali, tama po ba pagkakaintindi ko? Ipopost pa lang po yung case, no, Doc? Tama po.
Ano yon?
Yung para sa Tuesday po, wala, hindi pa posted yung case, no, Doc?
Hindi pa.
Okay po. Thank you po, Doc. Okay po.
Ipopost ko
Thank you.
lang. Ipopost ko.
Thank you po.
Okay. So you have to work as a group, no? So like group A, so see to it that everybody participates. Is that clear? Is it clear? Everybody should participate in the presentation. If you want several persons, several members will present excuse me, the different like for example the computation, one member will present it, then the modification, then the rationale. Okay. Any more questions?
May question po sa chat box.
Chat box. Nasaan ba yung chat box?
Ayun, sir. Doc, same group po ba sa forum group?
I think so, yeah. Kasi 10 din. Yeah, you will have the same group. So parang practice nyo to. How you will do it. Pero dito you will not prepare any food menu. Hindi kayo mag-prepare ng menu. But doon, you will have to prepare the menu. So, were the cases given already for the forum? Nandiyan na ba yung cases?
Yes po, kakapost lang po ata niya kagabi.
It has been assigned to you? Assigned na ba?
Yes po, Doc.
Okay. So that's good. Okay? Just relax. Okay lang ito. I mean, ito naman this is just a preview of what we will have in the forum without the actual preparation of the food. So, pero you will have to solve for all this TCR and distribution of the TCR to the different macromolecules. Of course, the BMI, no? BMI is important. Okay? Now, sa forum, pwede kayong gumawa ng mga skit tungkol sa about your cases. Pero don't make it too long, no? Because you will have, so that you will have more time in the discussion.
Doc, clarify ko lang po. Again,
Yes?
there are 10 members po per group in our case discussion next week. But sa GIT forum po, yung mga members na distributed, parang 20 po yata per group.
20 per group?
Opo, parang dun po sa list, ganun po naka-arrange.
Dito ba, ilan ba kayo? Ilan ba per group bakit 20? So dito 20 din. Yan ang mangyayari.
Kasi, Doc, kung 10 groups po kasi, each section is around 200 po. So 20 po talaga, around 20 po talaga po yung mga groups.
20
Kung 10
talaga.
Opo.
So you can have the same group as your forum. Dito din. Pwede rin 20. No? As long as everyone should contribute to the case. Para lang mag-practice tayo ng how to solve this or how to go about the case and modify the diet depending on the case. Ano? Okay ba?
Hello po.
Yes?
So next week po, just to confirm, we're gonna do it before class and have a presentation prepared for that class po.
Sa klase natin, yes.
Magpe-present kami during the class.
Yes, during the class. We have 4 hours. 4 hours, 10 ba tayo? 10 tayo. 10 kayo, no? 10 groups. So you said 20 per group. Okay. Okay naman yun. So you will have the same grouping as your forum. Siguro mga 10 minutes lang per group. Is that okay? Any more questions?
Hello po, Doc.
Yes.
May I ask if Asia Pacific yung gagamitin na basis for BMI classification rather than yung WHO?
Yes. So if your patient is a Filipino, then use the Asia Pacific. Okay?
Yes, Doc. Thank you po.
You're welcome. Any more questions? Any more questions? Yes?
None na po.
Nana, are you sure? Okay. So anyway, if you have questions, you can, you can message me sa sa email. Okay? 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 So if you do
Okay
not
po,
have any
Doc.
more, yes? Yes.
Ay, sorry, Doc. Wala po.
Okay. So are we done? Is everything clear?
Yes po, Doc.
Okay. So if you have questions, if you have further questions, just email me. Okay? O sige, okay. I'll see you next week.